and welcome to the Pregnancy series. In the first video, we spoke about preparation for a pregnancy. So you have reached a point and you have done a test, and glory be to God, the pregnancy test shows positive. What do you do? How do you navigate the first few weeks of your pregnancy? So in today's series, we are going to talk about the first trimester and how you can navigate it with ease and ensuring that your baby is healthy. My name is Dr. Eladu, and I'm an obstetrician and gynecologist, and I'll be sharing with you today. So the first trimester are the first 3 months of your pregnancy. So from the day of conception up to 12 weeks and 6 days. This period is very important because this is when your baby gets to form every structure in their body. So it is a very sensitive period for the mother, but also for the baby. And also it tends to be a very difficult period because due to the high levels of hormones in the pregnancy, for example, the progesterone hormone, the HCG hormone produced by the placenta, the estrogen, most of the pregnancy hormones tend to be very high to allow your baby to be able to grow. These hormones give side effects which are associated with the first trimester. So we find mothers can have nausea, vomiting, poor appetite. Others may have fevers in the evening, constipation, headaches. Others can feel so tired, fatigued, and excessive sleep. These symptoms are diverse, but primarily they are associated with the pregnancy hormones, which are very high in the first weeks of the pregnancy. Now, first things first, you have found out that you're pregnant, start your supplements. Because I know sometimes some people wait to come to hospital, but no, the advice and recommendation is start supplements, start folic acid. That is the basic important ingredient in the first trimester because this folic acid allows for the baby to form perfectly without any deformities and also prevents brain and spinal cord abnormalities. So start the folic acid. Then we normally recommend that if everything is okay, plan for a visit to the hospital within 6 to 8 weeks. Because by this time, the baby has started to form, the heart has started to form, and this would be the perfect time to do the first trimester scan if everything is okay. So make sure that you've had your visit in the hospital. By the second month of your pregnancy, you have already visited the hospital. In terms of supplements, besides just folic acid, we tend to recommend iodine is very necessary, vitamin D, and omega. And we are fortunate that there are quite a number of products out there in the market which provide a multitude of supplements. So you can opt for those if you'd like to have an array of nutrients to help your baby kickstart this process. But also the question should be that if at all you're having difficulty, especially with taking these medicines, then you can stick to just the basic folic acid. Do not kill yourself because you want to take the supplements that have so many other variety of nutrients. So just folic acid is sufficient, but if you can, and the nausea is not too much, then you can as well take the other supplements that have many other composition of nutrients. There are supplements we would like you to avoid in the first trimester. And primarily because some of these nutrients in high concentrations can affect how the baby forms. So we discourage any supplement that really contains vitamin A unless you are you've lived in an area which has low levels of vitamin A. We also discourage supplements that contain high levels of vitamin E and vitamin C. And this we discourage herbal concoctions in the first trimester. Sometimes I know you may be recommended to take them, but please avoid them because we don't know what could be in those concoctions. So those are regarding the supplements, what to take and what to avoid. And your doctor should be able to guide you on the quantities of the supplements and how often you should be able to take them. Now, sometimes because of this difficulty in the duration, the period may be tough. There are recommendations that have been advised by the World Health Organization that you can actually do at home, what we refer to as home remedies, to be able to handle things like nausea, to be able to handle things like heartburn, to be able to handle things like cramps. For the nausea, we recommend mostly ginger. Can be, you could take it in your tea, you could take it in with a glass of water. You just try and mix it up. Or you can as well use chamomile. You can include it in your diet. And those have been proven to reduce on the nausea. For the heartburn, most times could be coming from the diet. There are starchy foods that can increase the acidity of the stomach, or overspiced foods. So that may be a time for you to reduce on the spices of the foods, and eventually that tends to reduce on the heartburn. But if at all it persists, then things like milk, yogurt is able to help with heartburn. Then maybe we can also recommend a bit of antacids. Could be magnesium, it could be some of the syrups that could help you deal with the heartburn of the pregnancy, especially in the first trimester. For those who tend to have cramps in the legs or in the arms, then or the muscle pulls, we recommend a bit of supplementation in calcium and magnesium. For those who tend to have a bit of back pains, we encourage you to exercise, because pregnancy does not require you to just be immobile. We want you to be active, because that allows for adjustments to the symptoms and really the entire pregnancy itself. There are things that we also recommend in terms of lifestyle habits. What can you do in the first trimester? How can you modify your lifestyle, and what is acceptable? We do accept in terms of exercise. Those who have been exercising before, if you've been going to the gym and doing exercise, then you you should be encouraged to continue with exercise. Being pregnant does not entirely cease you from continuing with exercise. Although we try to discourage very strenuous exercises, lifting heavy weights and anything that applies pressure into the abdomen. But we do encourage you to continue with the dancing or the Zumba or the aerobics. Those are usually very okay. In terms of rest, we want you to have adequate rest. 8 to about 9 hours of sleep are recommended. Of course, already the first pregnancy comes with too much fatigue and a lot of sleep, being sleepy all the time, but sleep is very, very much welcomed in the first trimester. Hydration, hydrate. And this, I know that the water is bitter in the first trimester, but try to hydrate. You could try and find ways of taking in juice or taking in tea, take a bit of porridge. Any form of hydration goes a long way to actually help your baby to be able to form quite well. We also encourage you to reduce caffeine. The people who are addicted to caffeine, reduce to about 1 to 2 cups of caffeine in a day. If you've been someone who's been taking a lot of caffeine, just reduce, if possible, even cease, because caffeine can affect how your baby is forming. And dental care. Dental care is very important. Visit a dentist. Sometimes pregnancy, especially progesterone, can affect the gums, can affect the teeth. And so we would like for your dentist to be able to assess you and ensure that your dental check is up to date by the end of the first trimester. After you've done those, normally in a hospital, there are tests that we encourage you to do. And this is for all pregnant women. By the time you are coming to give birth, we should have done the following tests. You should have done an HIV test, which we usually do for a couple. So an HIV test is very important, because HIV can be transmitted from the mother to the baby, and we can prevent that transmission. We also encourage to do a hepatitis B test, because it does the same. It can be vertically transmitted from the mother to the baby. We want you to do a syphilis test. Syphilis can cause blindness and miscarriages. Those are very important. If you've not done a sickle cell test before in the prenatal or before conception, you are also advised to do a sickle cell test. Now, there are tests that we want to do to see how the mother is prepared for this pregnancy. We want to see your full blood count, especially looking at your blood levels. So a CBC will be a mandatory test. We will definitely do a urinary analysis to determine if there are any infections. We will be able to screen for malaria because it causes stillbirths and miscarriages. And we shall also do your blood group. Blood group is very important because we want to know if you're rhesus positive or rhesus negative. And eventually we want to do your sugar test in the first trimester, especially if you have a high risk profile for diabetes. Now, in terms of scans, make sure that you have done your first scan by the end of the first trimester. A first trimester scan is very, very important. It helps us to know when that baby is going to be 9 complete months or at term of 40 weeks. So there is an EDD, due date, placed on that scan that allows you to know when that baby is going to be 9 months. So that's a very important scan that you should not forego. If anything happens, that scan helps us to count the weeks of your pregnancy. And also the first scan helps us to see the number of the babies that you have and if the baby has a heartbeat or not, and or if this baby is safe and growing perfectly fine. So those are the things that I can share with you in terms of the first trimester. There is a lot of information, and key points are: when you notice you've conceived, start your supplements, go and visit your doctor. Do not wait to come later because you'd have missed the window of opportunity, and do the necessary tests to ensure that your baby can grow perfectly and healthy. Thank you very much.